Next guest, one of the most sought-after plastic surgeons and reconstructive surgeons in all of Los Angeles. Please welcome Dr. Michael Zarrabi. Hi, Doctor.
Thank you for having me.
So we're going to talk about having we're going to make our hands younger in 30 minutes.
Correct. Yeah, I've basically created this procedure. It's minimally invasive, non-surgical, to make our hands look more youthful, so that they match our faces.
Amazing.
Wow.
The before
Yeah,
and
that's
after.
a true telltale right there, right?
Yeah.
When you look and you see somebody's face, I've always been taught, look at their hands.
Yeah, absolutely. You know, we're getting better and better at making men and women look more beautiful with surgery and non-surgical procedures, but now we need to put more attention on the hands because it's a little more telling of our age.
Huh. I'm sitting on mine.
What?
Don't point it.
Why would you point out the fact that you're sitting on your hands?
I am sitting on my hands. No, there's the first thing you do is a telltale sign of like how old you are. So I'm sitting on my hands.
Well, later on, we're going to have a chance to actually meet one of your patients.
Right.
And speaking of, I was one of his patients accidentally.
Yes.
I'm going to show you a photograph. Just let you know, I'm okay, but the photo's pretty graphic.
Well,
but I gashed on my eye opened up. You can see that, and I had to go in and. Dr. Michael was out on a bike ride. It was a Sunday or whatever.
Yeah, I was mountain biking at the time, and I got a call from the ER, and they said, "You've got to come in. We've got a celebrity in the emergency room."
Well,
and,
who was it? Who was it? Good, Kim. All right, Kim. One for Kim.
I will tell you though how I got it. She's not kidding when she says she'll cut you. That's how I got it. She's like, I will cut you, and poof, I pushed her a little too far. Yeah, you beat me to the punch on that one.
Well, you can't tell. He's got a little teeny tiny.
Yeah, no, disappear completely.
Yeah.
You look amazing.
Phenomenal.
Yeah.
Oh,
nice job.
Thanks for fixing the mug.
My pleasure.
All right, got a couple more miles out of it. All right, we are joined now by board-certified plastic and reconstructive surgeon, Dr. Michael Zarrabi. His patient is Jasmine Paul, and here to demonstrate a technique that Dr. Mike, as I call him because he worked on me, I feel we're that close, to demonstrate a technique he created to make our hands look 10 years younger. 10 years, one for each finger, right? A lot of requests for this?
Yeah, absolutely. So I'm not only a plastic surgeon, but I'm also a hand surgeon. So early on in my practice, I had a lot of patients come to me and say, you know, I look great, but my hands just are so telling of my age. Is there anything that you can do? So I started looking into different things that we can do to try to improve the appearance of the hands so they really match the face.
Okay. We got a picture here. This is Madonna, I believe.
Yeah, so, you know, Madonna is gorgeous. She looks amazing for her age, but you look at her hands and you wonder who is, yeah, it really does.
Yeah.
Now this is Sarah Jessica Parker? Yes.
Right. Yeah, this really shows the features of the aged hand. You can see the tendons, you can see the veins, the skin is really thin.
Well, what happens to your hand? You lose collagen? Is that what it is?
Yeah, the aging process occurs everywhere on the body. All of our skin starts to age, so we lose the elasticity, the collagen becomes less, the skin becomes thinner, we lose the fat, and because of that, then we start to see all the veins and we start to see all the tendons and all the anatomy.
Okay.
Right, and then,
so we have some before and afters I think we're going to show of some of your work, right?
Correct, yeah.
So what are we seeing here, Doc?
So this is a patient who we treated a while ago, and we put some filler into the hand, and we also used a laser treatment. So you can see on the on the left side, the veins are more visible, the tendons are more visible, the skin has a thinner appearance, and then after the treatment, the skin looks fuller, healthier. You see them as well. The veins are less visible. So I think it makes a nice change.
do you have to repeat this process often, or how long does it last?
Well, there's a number of different products out there. What we used on Jasmine today lasts about a year to a year and a half. Yeah. And so in a year and a half, she may come back and we may not have to completely redo the treatment. We may just do a little touch-up. And if patients are looking for a more permanent solution, we can also use fat.
From your body?
Yep.
How long is this instant? Does this take time, over a period of time?
Well, we treated Jasmine about an hour ago, and
oh wow!
You know, we can take a look at her hand. So this is the hand that we treated.
Take us through with the procedure and what you did do.
So basically, what we did today is we start out by numbing the skin. So the procedure is virtually painless, and we gave her a number of injections with a filler, and the filler we then massage around, and you can see the difference between the right and the left hand. The veins are less visible.
Yeah.
The tendons are less visible. Let's put them together. So you can really see quite a remarkable difference, and the procedure took about 15 minutes.
Now this is this swollen still? Is it going to go down a little bit?
A little
Just
bit.
a little bit?
A little tiny bit. There's also a little bit of
see a
bruising.
difference.
That'll go away in about a week, and the swelling goes away in a few days.
That's to sort of fill in the crevices and whatnot. But
Exactly.
what about the surface? You know,
Right.
Yeah, what about the
you
little
can
spots?
play-
Right.
Or,
So that's the other part of the hand lift, is that what we're going to do is we're going to treat all of these sunspots with a wonderful laser. It's a Cutera XLV. It's one of the best lasers for treating the hyperpigmentation, the brown spots. So we basically do one pass, and then we'll usually have patients come back at about a week to 2 weeks later, and we may need to do just a little touch-up to make sure we got all the spots.
Really, does it come back like 6 months later or a year later?
Well, I think that if we apply sunscreen and we're vigilant about protecting our hands,
Right.
then the
be
sunspots
okay.
shouldn't come back.
Okay,
Okay,
so
well, I'm going to
let's-
put this on just because
Right.
it's like looking into the sun. I understand what this.
Here's your
Thank you
So
very much.
we're putting our protective
bright.
eyewear. Oh, I like that.
I like it. So colorful.
You have a great
Great.
skin color. That's
Wow, you look
fantastic.
great. Okay.
So you're going to do the procedure now, and as you do this, what you're using, is it just for hands? Is this for face?
No,
Is it
this
for
this laser is great for any part of the body, for photo damage, sunspots. It's also great for broken capillaries, veins. But in this particular situation, we're going to be using it just on the back of the hand. So we're going to
Okay.
use a little cooling gel here.
Is it going to hurt?
It will. That's a great question. So
Well,
it doesn't hurt me at all.
okay.
So this is a little cooling gel that we use. It helps to.
And are you still numbed from, or do you feel numbing
Yeah,
from earlier?
I'm fairly numb on this end.
Okay.
Pretty good though.
Okay.
You can.
So it's going to feel like a little snap of a rubber band on the back of the hand.
Okay.
Okay. So here we go. You ready? It's
Yeah,
going to
I'm
feel
ready.
like a
Go
little
for it.
snap
And we're wearing glasses because.
because
cool.
we
It looks-
want to make sure that the laser doesn't injure the eye. So it's
Okay.
very, very important that we wear some type of protection
Okay.
on
Now,
our eyes.
is she going to scab it all? From
So what we would expect after the treatment is a little bit of a pink discoloration to the skin.
Mm-hmm.
We'll also see that some of the brown spots have actually become a little darker.
Uh-huh.
And then over the next week or so, those spots will flake off. How are you doing?
how you
I'm fine.
feeling?
I'm
You're
still
doing okay?
breathing. Yes,
Can we-
I think I'll get through this.
Are you
you-
pretty numb still?
Yeah. No, I'm good. You
Okay,
keep
good.
going.
Let's
Do you
just-
have a pretty
Come
high
in.
pain tolerance, or are you typically?
Yes, I do have a pretty
Good
good
pain
pain
tolerance.
tolerance.
Okay.
Oh, you mean emotionally or just?
No. That's a whole other show.
Yeah, that's all.
Yeah, that's coming up later.
No, I'm
Yeah.
doing fine. I'm
Since
breathing.
since we put the filler in, the hand is usually pretty numb, so we can really do this immediately after the filler, and it's virtually painless. Let's move over just a
Sure.
little tiny bit over
And this
here.
is one pass?
This
what
is
you're
one
doing? You
pass
don't
that
need-
we've done.
Do you need to do several passes?
No,
Just
not
one.
necessarily. Today we're just going to do one,
Yeah.
and then if any of the spots haven't gone away, we may just do a quick little touch-up.
Okay. We're going to let you finish doing that. Thank you so much for
Yeah, no
loaning us, giving you a hand, or giving us a hand, if you will, in this segment.
If you would like to know more, you can visit our website at drzarrabi.com. And thank you very much, Jasmine, too.
Thanks.
Thank you, Doctor.
Thanks, Jasmine.